Hi guys, how are you? Good afternoon. I know you all are locked up in home. Stay home, stay safe. Unfortunately, we are going through a difficult situation. Let us pray Almighty to give strength to overcome this hard time. First time I am taking online class. If you have any suggestion or feedback, send me at the end of the session. Today's topic of discussion is spirochetes. Alright, we are starting with the general characteristics of spirochetes. Spira means coiled, chate means hair. So it's a group of bacteria with a thin, flexible, elongated, spirally coiled helical structure. So it is a simple classification. It is classified into two classes, Spirochaetaceae and Leptospiraceae. And under this class Spirochaetaceae, species Spirochaeta, Cristispira, Treponema and Borrelia. We are focusing today on Treponema. Next is about Treponema. The medically important species of Treponema are: first one, Treponema pallidum species pallidum. The disease caused by it is syphilis. Second one is Treponema pallidum species pertenoi. The disease caused is YAVS. Third one is endemic syphilis. It is caused by Treponema pallidum species endemicum. And the fourth one is Pinta, caused by Treponema species Caratium. About Treponema pallidum, the morphology is it is having a thin, delicate spiral type structure with pointed end, and it is with cork screw type of motility. And it can visualize only under dark ground or phase contrast microscopy. Can't see under the ordinary microscope. And staining is also it have a needs special staining techniques. That is its fluorescent stain and silver impregnation stain. About the cultural characteristics, this pathogenic Treponema can be maintained only by animal inoculation. It can't grow in artificial culture media. And whereas the non-pathogenic treponemes will grow on anaerobic culture media. And moving to syphilis. Syphilis is a well-known sexually transmitted disease. Even though the mode of transmission, the common mode of transmission is sexually transmission, but a non-venereal mode of transmission is also possible. It is by direct contact, blood transfusion and placental transmission. An incubation period is recorded as 9 to 90 days. The spreading mode is it penetrates through minor abrasions in skin. From there it enters lymphatics. From lymphatics it directly enters into the bloodstream and finally metastatic foci. And clinical manifestation, 4 stages are there: primary, secondary, latent, tertiary. An entirely different scenario is congenital syphilis. First is primary syphilis. It manifests as a hard chancre. Actually, it is a painless papule which ulcerate with induration, especially seen in genital area. It heals within 2 to 12 weeks. You can see the picture of hard chancre here. Along with the hard chancre, the patient also experiences regional lymphadenopathy. It is usually inguinal, with painless and non-separative. It persists for months. Next is about secondary syphilis. It appears 4 to 8 weeks after healing of primary lesion. It affects skin and mucous membranes. It manifests as skin rashes, condylomata lata, mucus patches. You can see the picture of all these conditions here. Next is about latent syphilis. Here the clinical manifestations are absent. The patient will be serological positive and the patients remain infectious during this period. If it progresses, if this latent syphilis progresses, it will lead to latent syphilis or persistent lifelong infection. Next is about late or tertiary syphilis. It manifests as gamma. Actually, it is a locally destructive granulomatous lesion, and bones and skin are usually affected. We can see severe gamma lesions in tertiary syphilis. Here there is a picture of it. Next is about neurosyphilis. It manifests as meningitis, meningovascular syphilis, general paralysis of insane, and tabes dorsalis. Next is about cardiovascular syphilis. It manifests as aneurysms. Last, about congenital syphilis. Here, fetal damage occurs only after 4 months of gestation. An earliest manifestation appears within 2 years of age with rhinitis, mucocutaneous lesions, bone changes, and lymph adenopathy, whereas the late manifestation usually appears after 2 years of age. They are interstitial keratitis, eighth nerve deafness, bilateral knee effusions, or Clutton's joints. Next is about residual stigmata. They are Hutchinson teeth, mulberry molars, saddle nose, and saber shine. And moving to a laboratory diagnosis of syphilis, here we are following microscopic examination, serological techniques, and molecular techniques such as PCR. And first is about the microscopic examination. The specimens are usually taken from superficial lesion, and we are observing under dark ground microscopy. Direct fluorescent antibody staining is also useful. Silver impregnation staining techniques such as Livadit and Fontana stain is usually employed. So you can see the microscopic observation of Treponema pallidum in fluorescent stain and silver impregnation staining techniques. Next, we are focusing on serological techniques. There are 3 types of serological techniques. First one, non-treponemal test or non-specific test or standard test for syphilis. Here the principle of this test is it detects reagent antibody in patient's serum against cardiolipin antigen. The second one is a treponemal test. Here detects species-specific antibody. The third one is a group-specific test which detects genus-specific antibody. The non-treponemal tests are Wassermann complement fixation test, Can tube flocculation test, VDRL test, rapid plasma reagent test, unheated serum reagent test, and toluidine red unheated serum test. And moving to VDRL test, VDRL means Venereal Disease Research Laboratory. It is a slide flocculation test. We are performing this VDRL test using a special type of cavity slide. In that slide, we are taking patient serum, that is heat inactivated patient serum. It is mixed with cardiolipin antigen which is commercially available. So presence of clumps indicates a positive test, whereas absence of clump indicates a negative test. You can see the presence of clumps here. And this is a special type of cavity slide where we are performing this VDRL test. Next is the advantages of non-treponemal test. It helps us to monitor the patient's response to treatment. Also, VDRL can be used to detect antibodies in CSF. Its sensitivity is very high, that is in primary stage it is 78 to 85% sensitive and shows 100% sensitivity in secondary and tertiary stage. And it is having some limitations. First one, it shows biological false positive. If you are using 1% normal sera, and also in certain clinical conditions such as pregnancy, lepromatous leprosy, relapsing fever, malaria, tropical pulmonary eosinophilia, viral hepatitis, and HIV. In all these conditions, this VDRL shows false positive result. And the next disadvantage is it shows prozone phenomenon, and sensitivity is very low in late stage. These are the major disadvantages. Next is the treponemal or specific test. Here the antigen we are using is a Treponema pallidum species specific antigen. The important specific tests are Treponema pallidum immobilization test, fluorescent treponemal antibody absorption test, Treponema pallidum hemagglutination assay, Treponema pallidum particle agglutination test, ELISA, and Western blot. The third category is the group specific test. Here it is not used because of its low sensitivity. For example, Reiter's protein complement fixation test. Last is about molecular methods. PCR also can be used to diagnose syphilis. Diagnosis of congenital syphilis is by direct dark ground microscopy of umbilical cord, placenta, nasal discharge, skin lesion material, and also IgM antibody can be detected which indicate recent infection. Next is about treatment. Penicillin is the drug of choice. Alternatively, tetracycline can also be used. So we have to evaluate the patient after treatment. For this purpose, we are performing a VDRL or RPR at 3 months interval for 1 year. In primary and secondary syphilis, the titers decline by 3 to 4 months, whereas in latent or late syphilis, a gradual decline is observed. And moving to preventive measures, as it is a sexually transmitted disease, treatment of cases and contacts is very important. Also, give proper health education about safe sex practices and prophylactic use of barrier contraceptive methods are important. Next is about non-venereal trypanomatosis. There are 3 types of non-venereal trypanomatosis. First one is YAVS, second one endemic syphilis, and third one Pinta. YAVS also called Pian fambrosia or baoba. The causative agent is Treponema pallidum species pertinui. It is usually reported from Africa, Southeast Asia and Central America. No cases were reported in India since 2003. The mode of transmission is by direct contact. The important clinical manifestations are primary extragenital papillomatous lesion along with regional lymphadenopathy, generalized secondary lesion, and in later stages gamma of skin, bones and joints. Next is about endemic syphilis. The causative agent is Treponema pallidum species endemicum. It is seen in Asia, Africa and Australia. The mode of transmission is by direct contact, kissing and sharing utensils. The clinical manifestation, 2 types of clinical manifestations are there, both early and late. Early, it starts as an oral papule which leads to mucosal patches, periostitis and regional lymphadenopathy. Late manifestations are gamma, osteitis and Janjos. The third one is Pinta. Causative agent is Treponema caratium. And epidemiology, it is reported in Central America and South America. The mode of transmission is by direct contact. Clinical manifestations are pruritus papules, pintides and dyschromic macules. And the non-venereal trypanomatosis can be diagnosed using dark ground microscopy and serological test. And the treatment, the drug of choice here is penicillin. Thank you for your attention. The assignment for you is you have to answer 3 questions. First one, lab diagnosis of syphilis. Second one, VDRL test, its advantages and disadvantages. The third one is non-venereal trypanomatosis. Send me in handwritten format by tomorrow 2 p.m. Your attendance will be marked based on that. Bye.